We are live. We are live. I'm Dr. Frita, and welcome to another Medical Monday where I give you all of the hot health topics in the headlines. Today, we will not disappoint because we have more medical news that has been highlighted in the headlines. We're going to start off with my favorite game, myth versus fact. We'll talk about the Diddy Combs trial and how it's been highlighting different addictions. And so we'll talk about some of these drugs that you've been hearing about, be it MDMA, Liquid X, ketamine, pink powder. We'll talk about some of these things and some myths versus facts when it comes to these drugs that have been highlighted. And then we'll get into your weekly dose where I give you a fresh take on the headlines that you simply can't get anywhere else. We'll talk about the beloved Ananda Lewis and how she recently lost her battle with breast cancer. She's been very candid. She did share that she was not getting mammograms due to some concerns about radiation exposure. She discussed how she did not go with a traditional treatment. And ultimately, she did pass away and had stage 4 breast cancer. I want to discuss what's going on with breast cancer statistics among Black women, and what you need to know about prevention and treatment of breast cancer. And then we'll talk about a very sad case. We'll talk about a 6-year little boy named Gunnar who passed away after inhaling helium from the balloons at his birthday party. Who hasn't inhaled helium from balloons? We see it all the time. Well, in his case, it was actually fatal. And come to find out, balloons are actually considered to be the #1 cause of passing away from suffocation among children's toys. And so we'll talk about the dangers of balloons. And I definitely want you to share this with any parents, any aunties, any childcare providers, because balloons can go from fun to fatal. Then we'll talk about, listen to this, the FDA has approved a lab-grown salmon. Are you going to try it? Well, we'll talk about the pros and cons because, believe it or not, there are some pros. We'll talk about this lab-grown salmon. And then we will talk about Real Housewife of New Jersey star Dolores and how she had a surprising heart health scare. Lastly, we'll go over our 5-minute health check. I'll give you some different highlights. You know, we are live. I'm Dr. Frita. I'm a quadruple board certified medical doctor. Hey, we have interaction. You can ask me questions, but I'm asking you questions too. So let's go ahead and get started. Welcome to Medical Monday. We are live. I'm Dr. Frita. Welcome to Medical Monday. Let's go ahead and jump in. You know I'm not doing this alone. To my co-host and my office manager, Shadora, please come to the front of the stage. How are you doing, Shadora?
Good, Dr. Frita. How are you doing today?
I'm doing very well. Did you have a good weekend?
Did have a good weekend. So my sister-in-law is officially licensed with her master's of social work. So we celebrate that this weekend. And of course,
that's so good. I'm very excited for her.
So yeah, so she's excited to do new things. And then of course, Father's Day, we had a pretty relaxing day. How about yourself?
We had a great weekend. Let's see, we had some good basketball. You know, my daughter, who is a rising high school freshman, got a chance to play in a showcase, and she played with the varsity high school basketball team, even though she's a freshman. They had a good showing, and so I'm really excited about the upcoming season. And then for Father's Day, we had a good Father's Day. I might have enjoyed it more than anyone else. I took my father and family out to a brunch, but I kind of took them to the club, Shador.
Oh.
It kind of turned to the club, and I liked it. It was T's Breakfast Bar. T's Breakfast Bar, which is a Black-owned establishment. She has wonderful food. The food is good. The service is good. But let me tell you something. In the middle of the day on Sunday at noon, the DJ came. Shador, the DJ saved my life. He started playing all the music from my high school soundtrack, from my college soundtrack. He brought on up to the front. Even my daddy said, as we were walking out, he said, I heard him playing the stanky leg. Honey, it was the club. So I don't know, but I'm definitely going back to T's Breakfast Bar, T's Brunch Bar. It was very good. Anyway, enough about me. Let's talk about these health topics. Shador, you know that Diddy stays very much in the headlines. And now there have been some people who are, sharing different drug use and talking about addictions. And so I do want to cover some myth versus fact when it comes to addiction. All right, so let's go ahead and play this clip. Do we have a clip? And then we'll get into some myth versus fact.
Yes, we do. Yeah.
Diddy's drug use led to graying gums and shaky hands, Jane says. Jane says she was aware of Diddy's drug habit and that after just a few dates, she could see he was depressed and had shaking hands. She says that when they were on the plane to the Turks and Caicos Islands, she could see he wasn't taking care of himself. Jane says, I felt he had jaundice, and his gums were graying from drug use, and his hands were shaking from consuming alcohol. Jane says she encouraged Diddy to go to rehab because he was overdoing the partying. Jane says that while she noticed a strong pattern during their relationship, she wouldn't label it as a drug pattern. She would now sum it up by saying Diddy was a huge party guy. Wanting Diddy to quit the drugs, she says Diddy previously spoke about ketamine therapy as a way to stop his Xanax habit.
Yes, so Jane is one of the witnesses, and she identifies herself as an ex-girlfriend of P. Diddy. And what she was describing with his yellow eyes, shaking hands, gray gums, now she's not a healthcare professional, but in her opinion, he did have some addiction to drugs. And she, as they just stated, she stated that he needed some type of a treatment center. Again, she's not a healthcare provider, but we know that even from what the FBI, what the federal agents have testified, they did find pink powder. They did find some drugs. They found ketamine. They found cocaine, among other things, in the raids of P. Diddy's homes. And so, you know, it looks like there is some established truth about him and drug use. So let's just take this to a place where we can all get a learning and an understanding. And so first, I want to know who was first in the chat today, Shador.
First in the chat today is Purple Onion.
Hey, Purple Onion, you know you have one of my favorite names. Welcome, welcome. Listen, I want you all in the chat to please share some of, especially if you've been following the trial, but share some of the drugs that have been used, at least that have been testified to have been used, and some of the issues and side effects with those drugs. And as you do that, we'll go ahead and get started. But please go ahead and give us a like, because I'm about to give you some evidence-based information over this next hour. All right. What's our first myth versus fact statement?
Yes, ma'am. And shout out to a new member, Dr. Frita Muhammad.
Welcome, Muhammad. Thank you for joining the membership. Listen, I did post. Did I? Yes, I posted just this past week a new members only video. I give you different members only videos, Muhammad. And for last week, I had to stop. I don't know if y'all noticed. I had to stop a little bit abruptly towards the end of this live. And in the members only video, I shared with you what happened. I gave you some information and some education about why I had to stop. So check that out. We also have live videos. We have live Q&As monthly. So please. Let's see. So make sure you join us for those. But thank you. Thank you for joining the membership. Welcome.
All right. Our first statement. If someone's eyes turn yellow, it typically means their liver is failing from drinking too much.
If someone's eyes turn yellow, okay, and you see a lot of people with yellow eyes, does that mean that they're having liver failure from drinking too much alcohol? Is that a myth? Or is it a fact? Put an M1 if it's a myth, if it means, hey, yellow eyes, too much alcohol, or is it a fact? F1. M1 if it's a myth, F1 if it's a fact.
All right. Statement 2, Dr. Frita.
All right.
Shaking hands are a sure sign of alcohol withdrawal.
Okay. So if someone has a tremor, if they have shaking hands, can you look at that and be like, that's definitely a withdrawal from alcohol. It's a sure sign. Put an M2 if that's a myth, and F2 if it's a fact. If shaking hands means for sure, it's a sure sign that you're having alcohol withdrawal.
All right.
All right. What's the next one, Shador?
If someone's gums look gray or oddly colored, it could be a red flag for serious health problems, including drug use.
Now, see, okay, if someone has gray gums or some gum discoloration, could this be a red flag for drug use? Now, Jane, and of course, Jane is her pseudonym, Jane Doe, but again, she identifies herself as an ex-girlfriend, and she said that Sean Puffy Combs had gray gums. Could this be a sign of drug use? Put an M3 if this is a myth, if Jane is tripping. Put an F3 if this is a fact, that it could be a sign of drug use. Pencils down, pencils down. Okay, what do we have, Shador?
All right. We have a mixed bag.
Oh, I love a mixed bag.
Statement 1. If someone's eyes turn yellow, it typically means their liver is failing from drinking too much.
Okay.
All right. With this statement, we have T Chosen.
Oh, hi, T Chosen. Welcome back. What do you say, T Chosen?
T Chosen says myth.
It's a myth. Okay. So you can't automatically look at yellow eyes and think you know someone is overusing alcohol. Okay, T Chosen.
Trina agrees, also a myth.
Hey, Trina, the baddest. Okay, a myth.
Anton.
Hi, Anton. Welcome back also. Oh, yeah, all y'all. Thank y'all for coming back.
And a couple of chiming in from IG, Dr. Frita.
Okay. Oh,
IG.
Hey, welcome, IG. What did I do for y'all this week? Okay, IG. I did a Father's Day post, okay, just kind of briefly on there with a picture of my dad. I did a really good tribute to my dad. And, for those of you who've been following me for a while, you know that my dad is a retired surgeon, a retired general and peripheral vascular surgeon. He was actually the first Black surgeon in St. Petersburg, Florida, my hometown. And he was valedictorian of his high school. He was just all kinds of accolades. But I give him a really great tribute because, of course, me getting a chance to do what I love now, being a physician, being a medical doctor who shares evidence-based information, I get it from my daddy. And so I give him that, and I really appreciate him. Just a second here. Let's see. Are you able to hear me?
Yes, we can hear you just fine.
Okay, good deal. And let's see, what else did I give y'all? Oh, it might be off by now, but I had on my story, us at Father's Day. Who heard tell of somebody taking their daddy to the club by accident for a Sunday brunch? All right, but welcome from IG. What do you have to say about this myth versus fact question?
I Dream of Gab says it is a myth.
A myth. So it's not necessarily alcohol if you see yellow eyes. Okay, I Dream of Gab. Okay.
And Vivian also says it is a myth.
All right, good deal. All right, anyone say it's a fact?
Yeah. What was it? Antoine said it was a fact.
Oh, it said it was a fact that if you see someone with yellow eyes, you automatically know that's alcohol. All right.
Yep. And Tisha agrees, says a fact as well.
Tisha says a fact also. The yellow eyes mean alcohol. All right. The answer to this one, it is a myth. It's a myth. Okay, Tisha, Anton, don't be mad. Don't be mad. Let me tell you. It's a myth because you got to look at how I phrase the question. Y'all know I'm like Rumpelstiltskin. I like to try to trip you up. Look at how I phrase the question. So if you have yellow eyes, the truth is, yes, it can be a sign of alcohol overuse, but it's not a sure sign. In other words, many other things can give you yellow eyes, right? You can get yellow eyes if you have pancreatitis, like inflammation of the pancreas, and it's blocking the bile ducts. You can get yellow eyes if you have a pancreatic tumor, if you have gallbladder disease, gallbladder cancer. Gallstones are a big one that can block your bile ducts. And you can also have it if you have liver failure from some other reason, from hepatitis A, hepatitis B, hepatitis C. If you have liver disease from liver cancer, if you have autoimmune hepatitis, like from lupus. So, or certain medications can cause you to have liver issues, which can lead to yellow eyes. So my point in this myth versus fact statement is just because you see someone with yellow eyes, please don't automatically say, I know you're using too much alcohol, because there are many other things that can cause yellow eyes. And now who's over there on IG? If you go to my IG, I did do an IG live on this past week, on Wednesday, I believe, yes, where I go into details about causes of yellow eyes. It's worth a watch, because if you have a loved one with yellow eyes, I recommend you send them to see their physician, because there are many things that can cause yellow eyes, many systemic conditions. alcohol, but many other things as well. And so your yellow eyes might be a little window into some health issues. All right, let's go to the myth versus fact statement number 2, please.
Yes, ma'am. Shaking hands are a sure sign of alcohol withdrawal. Also have a mixture on this one as well, Dr. Frita.
Okay.
From IG, Pam says it is a fact. Jay from IG also, she says a myth. Here, back over on YouTube, Mr. B says a myth. Tisha says a fact.
Okay. Can you hear me, Shador?
Yes, we can hear you just fine.
Good deal. All right. So go through a couple of those again. Who said it was a myth?
Yeah, mixed bag. So IG, Jay says a myth. Pam says a fact. Tisha says a fact. Our member Andrea says a myth.
Hey, thank you for being a member, Andrea.
And
All
Sherry
right.
says,
so drum roll for this statement number 2. It is a myth. See, I like a mixed bag. Okay, so shaking hands. You got to look at the words. Test taking. Again, I said sure sign. I said that shaking hands are a sure sign of alcohol withdrawal. Now, granted, alcohol withdrawal can cause shaking hands, no problem. If you have delirium tremens, you can get shaking hands. But there are other things that can cause shaking hands as well. So just because you see someone with shaking hands, please don't be judgmental. Don't be judgy-wudgy was a bear, because there are other things that can cause shaking hands. Case in point, anxiety can cause shaking hands, right? Also, if you have low blood sugar, someone with diabetes who's perhaps taken more insulin than required might have a drop in their blood sugar and they can get shaking hands, right? You can get shaking hands from that. Also, you can have just something called benign essential tremor, where for no identifiable reason, your hands just happen to shake. That happens with a lot of my patients, and we give them beta blockers like propranolol or metoprolol even. Other things that can cause shaking hands, if you have withdrawal from substances other than alcohol, okay, other kinds of drugs can cause shaking of the hands. What else? Parkinson's disease, right? Certain illnesses like Parkinson's disease can lead to shaking hands or intention tremors. And so these are just some of them. So my only point is, just because alcohol can cause yellow eyes, but it's not a sure sign of having alcohol abuse or alcohol overuse if you have yellow eyes. Alcohol withdrawal can cause shaking hands, but just because you see someone with shaking hands, it doesn't mean that they automatically have alcohol withdrawal. It's not a sure sign. You got to think about other things. And I do want to talk about delirium tremens, or that alcohol withdrawal syndrome, just for a moment. Delirium tremens, or DTs. Well, this is a syndrome that can actually really be life-threatening. And it occurs when someone who is alcohol dependent, they use alcohol most days or every day. If they stop using the alcohol, the time can vary, but certainly by 72 hours, if they've had no alcohol, but they are used to having alcohol every day and their bodies are dependent upon the alcohol, they can have a withdrawal syndrome called delirium tremens, or DTs. And with this, you can get shaking hands, you can get seizures, you can get fever, irritability, and you can even lose your life. I saw this a lot during my training, especially at the VA, Shador, because for people who really are alcohol dependent, when they're out in these streets, they get their alcohol, right? No problem. But if something happens and they're hospitalized, we're not giving you alcohol. We're not giving you margaritas and tequila and whatever kind of shots and what other kind of alcohol, beer. We're not giving that to you in the hospital classically. And so if you don't know that someone's alcohol dependent and they're in the hospital, after a couple of days or by day 3, if they start having seizures, tremors, shaking hands, you better beware, because that could mean that they have alcohol dependence, and perhaps you didn't know it as a physician. But it's not just that. For people, friends, family, people who do dry Januaries, people who say, I'm about to stop. If they truly have an alcohol overuse and they're dependent on alcohol and they stop cold turkey, got to be careful, because they can get those DTs, the shaking hands, the tremor, the fever as well. And so I recommend that anyone who wants to stop cold turkey, and you've been using quite a bit, for men, 2 or more drinks a day, women, 1 or more drink per day. Now, this is according to the CDC. these gender lines. But if you have been drinking alcohol, you know you're dependent on it every day. If you want to stop, I recommend that you consult with your physician, because there are some medications we can give you to help to prevent these withdrawal symptoms, these withdrawal syndromes. Okay. And in the hospital, when we have patients who come in, if we know that they have alcohol overuse disorder, if we know that they have alcohol abuse, or if their families say it, or sometimes, I'll be honest, sometimes at the VA or at different places, when I just wasn't sure, sometimes we'll go ahead and give you some prevention for delirium tremens just in case. Okay. Won't hurt, might help. We have to kind of use clinical judgment. And yeah, the treatment's actually quite interesting. Anyone who can look up and see what the some of the treatments for delirium tremens are, please do that and put it in the chat, and put DT treatment, and put that up there. I'll tell you some benzodiazepines, giving certain medications can do it, but there's something that's not a medication that can treat DTs. I'll come back and share that with you. But yeah, that was a good myth versus fact one. Thank you to everyone who comes in and participates. And for those of you who are new to me, hello, I'm Dr. Frita. I'm an MD. I'm a medical doctor who has been quadruple board certified. I am a board certified nephrologist, meaning I'm a board certified kidney doctor and high blood pressure doctor. I have also been board certified in internal medicine, pediatrics, and obesity medicine. So I love to talk about a lot. I read from medical journals every single day of my life. What? That's fun. And more importantly, I like to share the information. So thank you for being here. And here on YouTube, oh, Shador, we have over 870,000 subscribers. So thank you to everyone who has subscribed. If you have not, what you doing? Please give us a subscribe. And in turn, we will give you evidence-based information. I literally have hundreds of evidence-based medical information and videos. When you watch those videos, when you share them with your loved ones, it helps you to be your own advocate. So when you go into your doctor, not just for kidney disease, be it kidneys, high blood pressure, sleep apnea, lupus, cancer, you name it, be it infection, be it talking about immunizations, I talk about it, prostate cancer, lung cancer, asthma, sickle cell anemia. I have hundreds of videos, and I talk about things in a way that's easy to understand. And so it helps you to be in a good position when you see your physician to be able to advocate for yourself, for your loved one, and ask intelligent questions, okay? So that you're not overlooked and so that you're not mistreated. So please give us a subscribe, give us a follow. Hey, IG, hey, Facebook, hey to my replay crew, and go ahead and give us a like, please. We appreciate it. All right, Shador. What's our final myth versus fact before we move on to the weekly dose?
Absolutely. If someone's gums look gray or oddly colored, it could be a red flag for serious health problems, including drug use.
No, I'm not gonna lie.
Mm-hmm.
All right. Who gave these answers? When Jane said that Sean Diddy Combs had gray gums, I fell out the stool. All right. Who said that it's a myth? And who said that it's a fact that this can possibly indicate a drug issue, gray gums?
Mm-hmm. All right. Shaquille Oatmeal. Hey,
Shaquille Oatmeal.
Shaquille says a fact.
A fact that it can mean drug use. Okay.
Huge says it is a myth.
Hello, Huge. So you think that gray gums have nothing to do? You think Jane is just being salacious? Ooh, okay, Huge.
Sonetta says it is a fact.
A fact. You think it really can be related? This is interesting. All right, thank you.
Faye says it is
a myth. So you think this gray gums thing is just another thing to try to make Sean Diddy Combs look bad? You know, I don't think he's looking too great on the artist work. And I think it's a great artist, but he looks a little sinister with his gray beard and doing his heart sign after all these things he's been accused of, plus some things we've witnessed on tape. All right. Anyone else, Shador?
Yep, over on IG, they're still over participating.
Hey, I love y'all, IG. Oh, good. And look, we're up to over 50,000 subscribers. I think we're almost at 51,000 last I checked. But thank y'all, IG. I love y'all. And listen, that's really where I'm very hands-on largely, where I sit up there, I answer my comments. I'm more frequently, like every day, just about, I'm engaging on IG. So I appreciate y'all. Now, what y'all say over there on IG? What y'all say?
So they're mostly saying fact over there. Jay says a fact.
Okay. Hi, Jay.
Audrey, Gab, and Vivian. They all say
hi, Audrey.
fact.
Hi, Vivian. So you think that gray gums can indicate drug use, okay? And that's really interesting, gray gums. All right. The answer to this myth versus fact statement, drum roll, drum roll. It's a fact. It's a fact. Now, you notice I didn't say that it's absolute or it's 100% or it's a sure sign, but can gray gums indicate drug use? They can. They can. And so here's what's interesting. So it can be gray gums or some other discoloration. So whether it's MDMA, whether it's ketamine, whether it's smoking something, smoking marijuana, certainly smoking crack. I hope that YouTube doesn't try to get me or throw me off the algorithm. I'm not encouraging drug use. Do not do drugs. This is your brain. This is your brain on drugs. I'm just giving some medical information that, a lot of people will do substances, but vanity plays a role. And if they think it's going to give them gray gums, they might stop. So yes, it can be an indication of gray gums, can be an indication of drug use. Here are some other things that can cause gray gums. Poor oral hygiene. Okay. Can definitely do it. Also, if you get amalgam tattoos, meaning if certain some of the materials that are used in crowns or in fillings, if those get caught underneath your gums, okay, then that can cause you to have gray gums. If you get leukoplakia, if you get precancerous issues, especially if you're someone who chews tobacco, if you chew tobacco, as they call it down in the South, in the country, what are some other things that can cause gray gums? Some systemic illnesses can do it. So if you have anemia, if you have some immune disorders, if you have heart disease, then sometimes these systemic disorders can present with gray gums. Okay. And so there are many things that can cause gray gums, but drug use can be one of them. All right. Thank y'all for participating. And if you have some more questions, like especially about things that can cause the yellow eyes, the shaking, the jaundice, then put those in and we'll see if we have some time to get to a couple of questions. And if you want to have a full live Q&A, then please be sure you join us for the membership. You can click the link in the description or go to my one-stop shop, drfrita.com. We will be doing a members only live Q&A last Monday of this month. And, you can take advantage, ask me all those questions. If you have a doctor's appointment coming up, if you're not sure if you should schedule a doctor's appointment, if you have questions about your health or just health in general, some more health questions about the Diddy trial, then I will, for the full time, just be answering questions on our live Q&A. We have a lot of fun there. All right. Let's get into this weekly dose where I will give you a fresh take on the headlines you simply cannot get anywhere else. Shall we, Shador?
Yes, let's get to it.
All right. So this first story, it brings me no joy. It's about Ananda Lewis. I know y'all have seen her in the headlines, and we actually covered her story months ago right here on this Medical Monday YouTube Live, because she was a beautiful young lady born in 1973, and she was actually a trailblazer when it comes to media. She really was. She was on BET Teen Summit. She also was an MTV VJ. She was physically beautiful, clearly. She also was highly intelligent. And, when she was faced with sexism or misogyny or people just thinking that maybe she got to where she was because of her looks, after speaking with her it didn't take much time, you realize that she was a powerhouse. She was pro-woman. She was pro the culture, just really a beautiful young lady. Well, she was diagnosed with breast cancer years back. She had a lump, and admittedly, she was not getting mammograms because she had concerns about radiation exposure. So she did not get the preventive mammograms that are recommended. She didn't do her breast cancer screening in the way that it was suggested. And then once she got the diagnosis of breast cancer, she chose not to go the traditional route. She did not get the mastectomy, or I believe it was a double mastectomy that was recommended to her. And she did not get the typical amounts of chemotherapy. She did something called fractionated chemotherapy, where she got maybe 10% of the recommended chemotherapy, but she certainly did not do what the medical recommendation suggested that she do. Ultimately, we learned and talked about it here. She developed stage 3 breast cancer, and ultimately stage 4 or metastatic. And then she passed away. And so let's see, we have a clip on her, Shador.
Yes, we do.
All right, let's play a clip and let's talk a little bit about breast cancer. And I want you all to tell me in the chat if you understand kind of or agree with her not going through the traditional treatment, or do you think that when it comes to breast cancer, you really think we should listen to, for the most part, what medicine recommends? I'm curious to see what you say in the chat.
Right now, Ananda Lewis, the former MTV VJ and talk show host, died at the age of 52 following a fight with breast cancer. Eva Pilgrim back with a look at her life. Hello, Eva.
Hey, George. Ananda Lewis has been very public about her cancer journey, in large part because she wanted to raise awareness for other women. This morning, family and friends mourning her passing.
This morning, fans are celebrating the life of Ananda Lewis, one of the most popular video jockeys on MTV during the heyday of Total Request Live.
I'm Ananda, and we're counting down the top 10 videos.
On Wednesday, her sister sharing Lewis passed away at 52 years old after a several years-long battle with breast cancer, writing, "She's free and in his heavenly arms."
Welcome back to Teen Summit.
Lewis started in TV in 1995 as a host of BET's Teen Summit.
Well, it's 10 a.m., and you know what that means. Mail time.
Before becoming a fixture on MTV, hosting TRL.
So do you get to see any of your old friends from home?
And Hot Zone.
Yeah, I was a big Ananda Lewis fan, but she made her choices with as far as her treatment or lack thereof, as far as traditional treatment, and now sadly she has passed away. Right. And so it brings a lot of questions to the forefront. One, now in her case, no, she did not take advantage of all of the recommended treatments. But we do know, even with other Black women are 40% more likely to pass away from breast cancer when compared to other ethnic groups. Black women are more likely to be diagnosed with breast cancer at earlier ages and with more aggressive forms of breast cancer. And so it's a big issue, specifically with Black women. But I'm curious, anyone in the chat, be it Facebook, IG, Replay Crew, hello, or right here on YouTube, do any of y'all have any comments about her choices? And we know that she has the absolute right and had the absolute right to make her choices. But does anyone kind of agree, or someone who also chooses not to do traditional care? And why is that? I want to have a discussion. So y'all please go ahead and join in the chat. Why do you think that some people maybe don't trust traditional medicine, or that glaring number, 40%? What do you think contributes to Black women being 40% more likely to pass away from breast cancer when compared to other ethnic groups? And I'll go ahead and share what I feel. But before I go, has anyone jumped in yet? Shador?
Yes, a few people have chimed in.
Okay.
Trina says, I believe we should definitely listen to medical advice.
Okay. Yeah. And of course, I'm a physician, so I'm going to say the same thing, Trina. We should listen to medical advice, but not necessarily blindly, right, Trina? One thing that I recommend, second opinions. I suggest that patients get second opinions. And Shador, in the office, we get a lot of second opinions. And oftentimes when people come to me for a second opinion, when what the original physician has stated is very similar to what I would have stated, I'll be honest. I'll say, you know what? I agree with your physician, so forth and so on. And I'll send them right back to the doctor. In some cases, they say, oh, we know you agree with our physician. We like the way you said it. Some of them will stay with me, but I absolutely encourage them to go back to their physician. But I like the idea of a second opinion because, yes, I agree with listening to medical advice, but it's okay to get different perspectives. It's okay to question physicians. But sometimes when you go all the way off on your own and you completely ignore decades and decades of sound medical trials and medical advice, it can be to your detriment. So yeah, I agree with you, Trina. I listen to medical advice, but of course I also double check, do my own research, get other opinions.
Eunice shared. Hi, Eunice. She said,
Hi, Eunice.
Yes, I do believe that a person should listen to medical advice. My sister was diagnosed with breast cancer almost 3 years ago. They caught it early enough. She did have her mammograms annually.
Wonderful. That's wonderful. And so just think about that. So she's having her mammograms regularly. They were able to catch it. Hold on just a second. On just a second. Yeah. So had she not had her mammograms the way that she was, recommended to have, then the breast cancer might have spread. The breast cancer might have, she might have seen a different fate. But she had the mastectomy, it sounds like, as recommended, and she's doing much better. When breast cancer is caught early, then there really is a great 5-year survival when you catch it early before it has a chance to spread. And so, yes, that's based off of recommendations. And it is recommended that no later than by the age of 40, that people born as women, have the discussion with your primary care physician or with your OBGYN about screening, okay? And mammograms are our classic standard of care screening tool. You can also have 3D mammograms, which actually I recommend, especially if you are a person with dense breasts. And I'll tell you, a lot of young women and Black women other women as well can have dense breasts, and the 3D mammograms will pick up the cancer better than just doing the 2D mammogram. Most insurance companies, it's looking like, are starting to cover 3D mammograms. I know my insurance company will cover them, but if the insurance company does not cover, always ask the question, how much is the cost if I pay out of pocket? Because paying out of pocket, you know, a lot of times we make decisions on what's important to us. If you go out and you might go out to the club, or you might go on an extra trip that maybe you couldn't really afford. If you prioritize getting a hairdo that's $1,000 or $250, but then getting a 3D mammogram is out of pocket $99, well, prioritize what needs to be a priority. So before automatically saying, if the insurance doesn't cover it, I'm not going to, at least ask the question on what the price is and see if your life is worth putting it into the budget. So yeah. All right. Thank you for sharing, Eunice.
Yeah, absolutely. Miss Aileen shared.
Hi, Miss Aileen. Hey, Miss Aileen.
It's an individual choice on what type of treatment they want, or if they want any treatment.
Oh, definitely. It's definitely an individual choice. I'm glad you said that, Miss Aileen. So for Ananda Lewis, she made the choice not to get the mammograms. For Ananda Lewis, she made the choice not to get the recommended chemotherapy. She didn't get the recommended chemotherapy. That was her choice. And, and ultimately she did pass away. But I do want to say this. And once you finish watching this live, Miss Aileen, if you can swing over to my Instagram or to my Facebook, I actually did do a couple of posts of Ananda in her own words. Okay, if you go to @Dr.Frita, because Ananda herself shared that she wishes that she would have gotten the mammograms. And she said, in her words, she said that the concerns she had about the radiation from the mammograms were not completely false, but they were completely foolish. That's what she said. She said her choices were not completely false, but they were completely foolish. She said, because sometimes if you're worried about your health, if you're concerned about your health, you'll have to take a little bit of risk of something you don't want to get the greater risk of something you do want, which is living a quality life. So even Ananda, and this is what I really appreciate about her, she didn't just stand 10 toes down, like, it's my right, I made my decision. And it is her right, of course. But she came back and shared that she wishes she would have gotten the mammograms, because the exposure to the radiation versus ultimately passing away from breast cancer, I imagine, she's a mother. She has a very nice looking young child. I'm sure she would rather have been alive. And then for the fractionated chemotherapy, yes, always, take a look at the pros, the cons, but even Ananda herself recommends that women get mammograms. And I'm glad that she did that while she was living. There were some interviews just in October 2024 where she stated that. And so I appreciate her for that. Okay. All right. Anyone else have any comments about Ananda Lewis or breast cancer, or anything that they want to share?
Yeah, Jay from IG.
Hi, Jay.
Jay shares, drug companies make big profits, so she did not trust the system. Perhaps she could have entered a clinical trial to get new combinations of drug treatment.
That's it. So you bring up a good point, Jay, the mistrust. And we know, and we talk about it here quite a bit, there are a lot of reasons that people in general, and specifically Black people, it can have some distrust when it comes to health. I don't have to tell you about the Tuskegee trial. And for those of you who don't know about it, once we're finished with this live, please just go in the search bar, Dr. Frita, Tuskegee trial, or Tuskegee experiment, or Dr. Frita, syphilis. And I go into detail on how the government was behind all of these Black men, these men of low income, sharecroppers, trusting men. The government was behind them not receiving treatment for syphilis, even once a treatment was found. And they sat there and looked at them like lab mice and caused many of these men to not be alive, to spread syphilis back home to their families, to their wives. And so there are different reasons, and we know, and everything's not just in the past. Currently, we know that there are a lot of health inequities, health disparity. That's true. Okay. That's just a fact. And a lot of people don't trust big pharma. Okay. But the truth of the matter is that so many pharmaceutical items, drug, medications, treatments really honestly are life saving. And so when we have this distrust, it's okay to have the distrust and to go and to look and to check. And like you said, to look for clinical trials. We also have to make sure that we have a nice kind of a 360 view on things. Don't throw the baby out with the bathwater, because science definitely is very helpful as far as keeping us alive. But it's hard when someone's telling you a reason not to trust them to ever trust anything. But for our own lives, we have to make these decisions. And the good thing is that you don't have to make the decisions on your own. If you're not a medical person, if you're not a doctor, you're not a physician's assistant, you're not a nurse, you're not, if you're not an MD, you're not a DO, if you're not a doctor or a research person, you don't have to just depend on yourself. Find physicians you trust, find doctors you trust, find scientists you trust, find people who sit up here and read scientific articles every single day to help you in doing your research. You're not out there on your own. We all have different specialties, okay? I like to consider myself a bit of a know-it-all, but ask me something about a car. I'm not a mechanic, and I'm not going to sit here and make all these major decisions about my car when it needs repairs all by myself. I'm going to call someone who studies cars, who fixes cars, who repairs cars. That's what they do. Okay. So you're in a community. To everyone who's listening, you don't have to be a physician in order to make these decisions and say, I don't trust science and I'm out and I'm on my own. Do your research. Okay. But do meaningful research and also rely on people who are in that field to help you as you make your decision. All right. Anyone else comment on Ananda Lewis?
Yeah, Lisa actually shared a personal aspect from it. Lisa says, I would have the bad cell removed. I had breast cancer in 2021 and I had it removed, but the treatment gives you other things that I'm dealing with right now. Today is a nonstop situation for me.
Oh, I'm sorry, Lisa. And thank you for sharing. And Lisa, you really do bring up a point. And I'm really sorry that you've had this diagnosis. And you're right. With various treatments like chemotherapy and radiation, there are always risks, there are side effects. Okay. And so it's a matter of weighing the benefits with the risks. I know that there's one breast cancer treatment, doxorubicin or adriamycin. It's wonderful as far as killing the breast cancer cells, getting rid of the malignant cells. But when you're on it long term, you have the possibility of getting a dilated cardiomyopathy. Okay. So you might be trading one treatment, treating the breast cancer with possibly having heart conditions. That's just one example. And so it's important that you weigh the pros and the cons. And anyone who tells you that any treatment is 100% safe with absolutely no side effects, it's just not so. But as I see you're facing firsthand, and Lisa, we just have to make decisions in life. And one important question for everyone who's listening to the sound of my voice, ask, okay, good. You like if your doctor gives you a treatment regimen, we want you to do chemotherapy, ABC, radiation, DEF, say, great. What are the side effects? What are the potential side effects? What percentage of patients develop these side effects? How many of your patients come back to you and say, I wish I wouldn't have done that treatment, but I would have done another? If I were your mother, your sister, your niece, what treatment would you recommend for me? These are important questions. And sometimes they catch physicians off guard when you say, what would you do if it were you? What would you do if it were your wife, your child, your whomever? Ask those questions and really push and advocate for yourself. Lisa, I'm praying that you do well. And I do thank you for coming on and sharing with us and with the rest of the med heads here today. Thank you.
Absolutely. Thank you, Lisa. All right, Dr. Frita.
All right. Shall we move on to the next one? If y'all have some questions, go ahead and put them in, and we might get a chance to just kind of pop in and do a few of them today. This next story, Shador, is about my little 6-year-old boy, and it doesn't make me happy. There was a 6-year-old child who really just graduated from kindergarten. His name, Gunnar. He had a birthday party, and he was doing what a lot of people do at birthday parties, inhaling helium from a balloon, where it makes your voice sound like Donald Duck. No big deal, right? Pretty benign little party trick until it's not. This 6-year-old birthday boy passed away after inhaling helium from balloon. And guess what? Balloons are considered to be the #1 cause of passing away from suffocation among all children's toys, according to the U.S. Consumer Product Safety Commission. So for anyone who is a mom, a dad, an auntie, a caretaker, please listen and please share this, because balloons can be fatal. Let's play this clip, Shador.
Were held today in Mount Carmel, Illinois, for 6-year-old Gunnar Hyatt. His family said he died after breathing in helium from from balloons used to celebrate his birthday just days before. He had just finished kindergarten.
Your lungs fill with helium instead of oxygen, and very quickly you do not get enough oxygen to your brain, which can lead to loss of consciousness and even death if you inhale too much helium.
Lots of people use balloons to make celebrations more festive, and they certainly do bring a smile to your face. But if used incorrectly, they can bring tragedy. These moms both lost daughters in separate incidents. They suffocated when they placed giant mylar balloons over their heads after their 7th birthday parties.
I could see that the number 7 mylar balloon was completely over her head and she wasn't breathing.
Now, another family finds itself mourning the death of a youngster gone too soon.
Yep. The 6-year-old birthday boy. Please put in the chat if you are surprised by this information. Just put surprised, okay, or put a balloon emoji if you didn't know how dangerous balloons can be. And then I'll go and I'll talk a little bit about balloons and the dangers. And so you see there that this young boy inhaled helium and he passed away. And so according to, and this just happened, okay, this happened on May 29th, 2025. So we're not talking about some long ago incident or from some old fashioned helium. No, May 29th, 2025 is when we lost Gunner, this 6-year-old boy. What happens when you inhale helium? Helium is a really light gas. And when you inhale it, it can displace oxygen, okay? And it can actually make you hypoxic or have low oxygen, and it can lead to passing away, especially if you're inhaling from a large mylar balloon or if you have asthma or some other chronic lung disease, okay? So inhaling helium, especially if you inhale too much helium, and what is too much? You don't want passing away to be what makes you find out what's too much. So inhaling helium and sounding like Donald Duck, yes, it can get you a couple of laughs, but can also take your life. Some other things, Shador, that make balloons dangerous, that suffocation piece, okay? So we know that when balloons are deflated, imagine if you're a kid and you're trying to blow a balloon, you really don't know what you're doing, and you kind of accidentally breathe the balloon in your mouth, or you just pick up a balloon, a nice little chewy deflated balloon. Imagine if you breathe that in, where you can pass away, you can suffocate. And again, according to the US CPSC, balloons are the #1 cause of children passing away from suffocation among all other toys. Think about when balloons pop. Pop. Oh, who doesn't like to pop a balloon? Okay, I really don't. But people like to pop balloons, and you have balloon fragments on the floor at parties, and you don't really worry about it. But what if a toddler kind of goes by, or a 3-year-old, or 4-year-old, and they just want to put the big colorful piece of balloon in their mouth? It might look like a piece of candy. They can choke on it. They can suffocate. And it's not just kids, it's adults also with the suffocation. You saw in the clip where the young girl pulled a mylar balloon over her head and suffocated. Well, there was a case in 2006 where college students, Shador, were found unalive, and they had climbed into an 8-foot tall balloon, okay? And they suffocated. There was a 5-year-old boy who passed away because there was a dinosaur balloon. He pulled that over his head, and his mom said that he had wanted to have a costume like a dinosaur. So, you know, it looks colorful, like maybe a costume. He pulled that over his head and he passed away. I'm sharing this not to be a fun snatcher, but because if you don't know, there's nothing you can do about it. But I'm sharing this information. According to the United States Consumer Product Safety Commission, it's recommended that children less than the age of 8 not play with balloons unattended. No, I'm not saying your kids can't play with balloons. It's perfectly fine when they're inflated and they're bouncing the balloons around. That's fine. But make sure that they are supervised, because if that balloon pops and they're fragments, you need to clean them up quickly, especially for kids less than 8, so you don't put them in their mouths. If they're deflated balloons, don't let them be hanging around a young child. They might put them in their mouths. And certainly, even though a nice birthday balloon might be nice to kind of hang on your child's crib or put in your child's room, especially if the child is less than 8, please take the balloons out, put them in a common area, because balloons can go from fun to fatal very quickly. Any comments on balloons? This one was a shocker, I know, to a lot of people.
Yeah. Eunice.
Hi, Miss Eunice.
Eunice said, I never let my kids play with balloons because I heard about this years ago.
Oh, good.
I'm up here.
Yeah.
Miss Aline said she's surprised by this.
Let me tell you, Miss Aileen, I'm a physician, and I was actually surprised at the great number. Now, you know, I sit around here like nerdy McFurdy, and so I'm always paying attention. But like when I think back to when my kids were less than 8, I'm pretty sure that, you know, I'd be upstairs asleep and have balloons down here, you know, not really thinking of it like that. So, knowledge is power. So it surprises a lot of people. And another thing, Miss Aileen, there was a 20-year-old woman, a New Zealand woman, and she was at her having a birthday party for her daughter, and people were inhaling helium from balloons, having the high-pitched voices. She actually went straight to the helium tank and inhaled balloon from that. She passed away, and they inhaled helium from the helium tank. She passed away almost instantly. And this happens quite a bit, especially with teenagers. And listen, the people who pass away the most from balloon suffocation are boys less than 8. Y'all watch these boys. Everyone can do it, but it just so happens statistically that it's boys less than 12. Boys less than 12 are the ones who pass away most often. But here's with the 20-year-old woman. So she inhaled it from the helium tank. And here's what happens with that. It's not just a matter of the helium displacing oxygen when you do it from the helium tank. It's the high pressure, right? Because these balloon filling systems or these helium tanks are meant to fill balloons rapidly, right? And so there's a lot of pressure. Well, when you put that pressure into the lungs, it can cause your air sacs or your alveoli to rupture, and it can cause bleeding in your lungs or pulmonary hemorrhage. And CPR doesn't typically help that. It can be fatal pretty instantly. So it's adults as well who need to hear this information about the balloons. Yeah. Anyone else, Shador?
Yeah, Ethioma.
Hi, Ethioma.
Says not surprised at all.
Okay. Yeah.
And natural to the T. Say yes, surprised.
Who said they're surprised?
Natural to the T.
Natural to the T. Because no one really talks about it, right? When you hear balloons, you think festivity, happiness, and you think children, babies, young, yeah, no, it can be fatal. So once you're finished watching this live, please make sure you check out. I did a reel on IG. I put it on Facebook. Everyone in the replay crew, y'all go check it out too, where I talk about 5 things to know about why balloons are dangerous. Make sure you share this with teachers, with parents, with aunties, with grandparents, with caregivers, with Sunday school teachers, because most people don't know about balloons and the safety. So please check that out and share it. And make sure you share this live, and go ahead and please give us a like, give us a thumbs up if you have not done so already. All right. So, oh my gosh. Listen, put an F in the chat if you like fish, if you eat fish. And y'all know that I'm forever talking about fish, omega-3 fatty acids, vitamin D that's in salmon, eating fatty fish, how that's good for heart health. I love fish. I especially love salmon. Okay. Oh, I love fish. But put an F in the chat if you love fish. Because the FDA has now approved of a different type of a fish. Specifically, the FDA has approved of a lab-grown salmon. A lab-grown salmon. Let me know if y'all would be willing to try a lab-grown salmon. Shador, let's play this clip, please.
All right.
Imagine sitting down and ordering salmon, but it didn't come from a fish. This salmon was grown in a lab. A few days ago, the FDA gave the green light to Wild Type's lab-grown salmon, meaning it's officially safe to eat and now being served at a restaurant in Portland. That makes it the world's first ever cultivated fish approved for human consumption, moving seafood beyond just poultry and beef. Wild Type's process. They take salmon cells, give them food, oxygen, and magic, and grow them into real salmon tissue. The FDA has no questions. Safety letter means it's considered just as safe as conventional fish. This isn't synthetic, it's fish flesh, but without catching a fish. So,
all right. Who in the chat loves fish, and who in the chat would try a lab-grown salmon? Say yes, I would try it if you would try it. Or put comments on why you wouldn't try it. But let me tell you about it, though, as you get ready to answer. This lab-grown salmon, there are some pros and there are some cons. Now, some folks just think that science has gone too far and they want to sit on the dock of the bay and they want to fish. I mentioned last week how my parents are up here visiting from Florida, and my dad and his brothers go on a fishing trip every year. They just go sit out on the boat, sitting on the dock. They like to fish, okay, and enjoy fish and catch the fish and, take pictures and have a struggle with the fish. Like there's a whole thing, right? A whole kind of enjoyment of fishing and having fresh fish, especially nice wild caught fish. But now that the FDA has approved lab-grown fish, well, that might cut back on some of the people who fish for a living, right? Our fishermen who actually make their living from fishing. And, that's something that could happen. So I suppose that's a con. Also, some people are just suspicious. If something is grown in a lab, well, it tastes as good, or is it just not natural? Even the scientifically, grown or modified fish. But it really is fish. They take salmon cells and they modify them in a way that they grow, and it really does look like fleshy salmon. It is fish from salmon cells. It's just not fish that came from natural reproduction and from the water. So it's kind of throwing some people off, like it's a bit odd. But here are some pros, Shador, because I know you eat fish as well. Here are some pros. With a lot of our fish, it will have mercury toxicity. And so for women who are pregnant, for example, you're told not to really eat too much fish. You don't want to expose your unborn child to mercury. Well, with this new fish, they're able to control pollution, right? So you don't have pollution, you don't have mercury. Also, with this new fish, any type, it could possibly, it could possibly help with hunger, right? If you're able to figure out a way to efficiently make a lot of fish, as much fish as you need in a lab, then perhaps for people who are in food deserts or who are hungry could get a hold of some of this fish, right? So those are a couple of the possible pros. But did anyone chime in, Shador? And if they're anxious to try this lab-grown salmon, and what about you, Shador? What are you thinking right now? Let's talk about lab-grown salmon.
I don't think I want to try lab-grown salmon. I'm actually just cracking up on the comments.
What they say? I know they acting up. Come on, Medheads. What are y'all saying?
Well, Michael Jackson Shadow.
Michael Jackson Shadow.
Mm-hmm. Yuck. I pass.
You know what? All right, you pass.
Does eat fish.
All right, who else?
Eunice says into the no.
Oh, into the no. Heck to the no. Okay, no on the fish. All right.
Anita says yes to fish. She does eat fish, but no, not at all. Am I willing to try or eat it regularly?
Not trying to do the lab grown. Okay.
Mm-hmm. Natural to the T. She says I avoid foreign raised, so I want lab grown. So what mine?
That is interesting. I also avoid farm raised fish, and I like wild caught, like the wild caught salmon. Truth be told, it's more expensive, to get the wild caught. But okay, that's interesting. Natural to the T. You have an open mind about it. Very good. All right.
Over on IG.
What's IG talking about?
Jay says, well, let them eat it, not us, from no label. Totally ridiculous. Just no.
All right, Jay. He said, let them eat it. I'm not even asking who them is. I hear you, Jay. Let them eat it. Okay.
And where's the comment? Sheree says, does it have to be labeled? I want to make sure I don't eat it.
Sheree, you took the thought right out of my head. If it's FDA approved and you go to a restaurant and you ordered yourself some salmon, okay, if you order yourself some grilled salmon with broccoli and asparagus and perhaps a touch of quinoa, does the restaurant have to tell you that it's lab grown? I don't know the answer to that. It's just been FDA approved. I'm going to find out. Shador, please remind me. I'm going to bring out next week. I'll let you know. Because I thought about that also. We're all sitting here declaring on what we will and won't do when it comes to lab-grown salmon. But what if you go to the market and your fish has already been filleted, and so you don't see a head, you don't see a tail, but that's normal. But because it really is salmon flesh, you likely won't be able to tell the difference visually. Can you be sitting up here eating lab-grown salmon and not know it? Jay, you hear me, Jay, on IG? Do they have to tell us? Oh, that's such a good question. Thank you. Come on to the front of the class.
It is.
All right. Oh my God.
And then Miss Aileen, she's like, I don't like farm grown fish. I would definitely not eat a lab grown fish.
Not farm grown. See, but now when we go to the grocery stores, they label the farm raised, right? Farm raised catfish, farm raised salmon, and they label the wild caught. But can restaurants serve us lab grown salmon without us knowing? Oh, Sheree, you done messed me up with that question. I sure was thinking it.
All right.
All right.
Last comment, Dr. Fisher. Nana BC does eat fish and says frankenfish.
Frankenfish, like Frankenstein.
Yes.
You know what? You tried it. That's funny. Oh my goodness. That is a good one. Y'all make sure y'all please give us a like as you listen to this, because now look, thanks to what we're revealing on Medical Monday, when y'all go to restaurants, watch you. Y'all going to dinner tonight, probably going out and you were planning on ordering yourself a little blackened salmon, you'll be like, excuse me, pardon me, is this lab grown? Now you know at least to ask the question. But yeah, that's interesting. I'll tell you, I'm not excited about trying lab grown salmon. So if I had to say yay or nay, absolutely, I'll say no. Because I'll tell you, there have been lab grown other meats as well. You know, there are lab grown chicken, right? Lab grown chicken has been approved and some other meats as well. And if I'm aware of it, I'm not eating it. And, you know, and that's not to say perhaps I will become fluid. Maybe perhaps I'll be open. Maybe I'm just resistant to change. But honestly, if lab grown were the only type of salmon I could have as opposed to wild caught, I'll just eat something else. That's where I am right now. It is interesting though, what they say about having no mercury, no pollution in the fish. And that food desert thing actually does intrigue me. If I had a choice between people going hungry or opening it up and sharing lab grown salmon, as long as it is safe, choice between hunger and no hunger, I would choose no hunger. I would choose life. And so I might be a little fluid on this opinion, but right now I'm gonna go ahead and pass with most of y'all and with Jay, let somebody else eat it, get somebody else to dur it. Oh my gosh. All right, let's go ahead and hit this last story, Shador. And, you know, and of course, y'all know I always enjoy talking to y'all here on these lives. But if you want to talk to me one-on-one, I do offer a telehealth concierge service where I can take your history and we can do a video call and I can talk to you about your medical issues from anywhere in the world. Please click the link in the description. Also, you can always go to my one-stop shop, drfrita.com, to book your appointment. I'm really having fun. I've talked to people from all over the world with this concierge service. And sometimes folks will come up to me for a second opinion or just to kind of get some more highlights on things they've heard in the lives or in my videos. So yeah, please come on and see me for the concierge. If you want to ask your questions, not necessarily one-on-one, then of course, join the membership. And then once a month, we have a live Q&A where we just go back and forth for the entire time and have a good time. All right, good deal. All right, let's get into this last story. Listen, there's no secret to y'all who've been following me for a moment. I sit up here, I watch Bravo. Okay, I watch Real Housewives. Well, Real Housewives of New Jersey star Dolores has shared that she had a heart health scare. Yeah, so let's go ahead and play that clip and let's talk about heart health.
I gained 20 pounds.
What?
20.
She doesn't look it. She's so high.
No, she knows. I've been looking for therapy for all my friends. I'm really having a bad time with this.
Can you switch to like
Ozempic?
to another Ozempic, Wegovy, something?
I did it all. So I stopped taking it for like a month because I didn't post about this yet, but I'm going to soon. I had a cardiac ablation. So I said, well, I might as well stop taking it anyway.
Okay, so explain the cardiac ablation. What?
I had AFib. Remember Paul went in the hospital and had this ablation done, this heart ablation.
Is it contagious?
No, I don't know what it's from. I don't know what it's from.
You both had the same thing?
That is
He
weird.
had something different. He had a congenital thing. I had something new that a lot of people are getting now at a young age. They said this is for like older people. So they can say it's from something. I'm not going to say what, but there's no proof of that.
The COVID shot?
Well, yeah.
We could say it.
Okay. All right. So that's Dolores. So the first thing that she was talking about was that she stopped her GLP-1, her weight loss shot, and then she gained 20 pounds after that. And, you know, even when we go back to the studies, they showed that for the majority of people who were taking those GLP-1s, like the Mounjaro, the Ozempic, that when they stopped it, and the effects of the drug reversed, and a lot of them gained the weight back. There are people who stop it and who are able to really pick up on their lifestyle and to hold off the weight, but by and far, most of the people who stop it will gain a lot of the weight back. So that's an important detail to know when you're starting the weight loss drugs. But for her, the heart health issue she was talking about was atrial fibrillation. And so for atrial fibrillation is when your heart has an irregular rhythm, okay? So instead of doing the ba-boom, 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 regular beats from 60 to 100 beats per minute, it's going all over the place, which can cause the blood in your heart to kind of slosh around and clot, and can even cause you to have a stroke, which we've talked about here on Medical Mondays before. And so she's pretty young and she had atrial fibrillation, which was a surprise to her. And, you know, they did do a little tidbit in there where they talked about the C19, the COVID shot. And that was something that has been talked about, like myocarditis and AFib, different things have been thrown around. I do want to make sure that I bring out the point that we do not have any overwhelming evidence that the COVID shot causes AFib. And I'll tell you, if you look at the numbers, and all of us, myself included, who've had multiple COVID shots at this point, most people, by and large, do not get any kind of AFib. They don't get myocarditis. And so there's a big narrative that's going around, but the benefits, we do believe, outweigh the risk when it comes to the COVID shots. Make sure you do your research and don't just listen to me, talk to your physicians as well. I want to make sure that we don't have any misinformation spreading about that. The COVID shot has not been found to cause AFib. Dolores, but she tried not to say it. The host said it. And so I'm not putting that on Dolores. But let's talk more about the AFib. With this abnormal heart rhythm, atrial fibrillation, one of the treatments is cardiac ablation. And what's happening in AFib is that instead of your heart just having the regular nodes of electricity that signal it to beat properly, sometimes you have these different nodes of electricity other places that are making the heart beat irregularly. And so what the physicians can do, what these electrophysiologists, these cardiologists can do, is they can find the spot that's sending signals that are making your heart beat in an irregular fashion, and they can ablate it or stop it. They can get rid of it, okay, through a procedure. And it sounds like that's what she had done. And so now that's going to decrease her risk for stroke, decrease her risk for having like a dilated heart or cardiomyopathy from atrial fibrillation. Okay. So that is that on Miss Real Housewife of New Jersey, Dolores. I hope she does well. I hope she continues to have a good, healthy weight despite being off the GLP-1. And yeah, any comments on that before we go into our 5-minute health check, Shador? And we'll wrap this thing on up.
No comments on that subject matter.
All right. I will say when Dolores was talking about how she's relatively young, and you think about atrial fibrillation and people who have high risks, some of the risk factors that we think about for AFib are people who are living with obesity, people with hypertension, people with diabetes, okay, people who are smokers, people who have alcohol overuse. I don't believe that Dolores has any of those things, and still she got it. So sometimes even if you're not listed on the risk factor table in a medical book, life happens and you can still get things. So we always have to be aware and listen to our bodies. And as far as hypertension being a risk, y'all know I do have a book on hypertension under pressure, a guide to controlling high blood pressure. Please make sure you either click the link in the description here or go to my one-stop shop, drfrita.com, and purchase your copy of Under Pressure, a guide to controlling high blood pressure. I don't just talk about medicine, even though, yes, I am a board-certified kidney and high blood pressure doctor, and I do prescribe medications when necessary. I also talk about natural ways to lower your blood pressure, using food as medicine, exercise as medicine, slow, deep breathing as medicine, juice as medicine. So please go ahead and get a copy of that. All right, Shador, are we ready to wrap this thing up? Y'all make sure that y'all give us a like and a follow and a subscribe. I appreciate you for being here. I especially appreciate you for all the participation on IG, Facebook, YouTube, Replay Crew. I see y'all. All right. 5-minute health check, Shador. What do we have?
All right. So sipping your way to diabetes.
Oh my gosh. A study has come out that drinking certain sugary beverages like sodas or pop, if you're from the Midwest, can increase your risk for diabetes, even more so than foods like donuts. And this is the science behind it. When you're drinking liquid sugar, liquid calories, it's absorbed more rapidly, and it can cause a really fast or rapid spike in your glucose. If you're eating sugary foods that are sometimes paired with other things like fiber, proteins, complex carbohydrates, that might cause a slower absorption of the sugar and a less rapid increase in your blood sugar. So make sure that when you're drinking, try to mostly drink water or minimally processed beverages, please. And once you finish this live, please check out my video on, one I just released last week where I talk about fruits to avoid if you have diabetes. Oh, y'all gonna be mad at me, but don't worry, I give you some options. But I go into detail about glycemic index, glycemic load, and what it means to have a rapid rise in blood sugar. But definitely drinking your calories can cause a rapid rise in blood sugar. It can put you at a higher risk for diabetes than even eating some sweet foods like donuts. That's scary. What else you got?
Dr. Pepper recall exposes zero sugar mistake.
This is a nightmare. So my youngest daughter, my 14-year-old, Dr. Pepper is actually her favorite soda. But right now she's decided she's going to try to give up sodas or minimize her drinking of sodas, which that makes me very happy. But Dr. Pepper there were about 19,000 cases of Dr. Pepper that had to be recalled because they were labeled as being sugar-free, which of course many diabetics will drink for their life, but then they were found to have real sugar in them. And so for the diabetics who drank those, if any of them ended up with blood sugar spikes or even worse, in a diabetic coma for drinking a bunch of what they thought were sugar-free Dr. Peppers, then that's an issue. So just make sure you check it out and take a look on, go ahead and look it up online to see if the Dr. Pepper that you thought was sugar-free actually has sugar and it's been recalled. And please put it down and grab you some water. And once you finish this live, please check out my video on the benefits of drinking water right here on the YouTube channel.
Sardine Girl Summer, fishy trend on TikTok.
Shador, do we have this clip?
Yeah, I think I have a clip on.
Let's close out with this clip. Sardine Girl Summer, a fishy girl summer. That doesn't sound good, but it is. Just check it out, y'all. Check it out.
First, there was Barbie Summer.
Hi, Barbie. Hi, Barbie.
Then there was Brat Summer. And now there's Sardine Summer.
What's going on with the sardines?
Yes, the tin fish are having their glow up with Google searches for sardines at a record high this month.
Who decided it was the summer of the sardine? They're on everything.
Companies like Fishwife saying consumers are looking for an escape.
Consumers associate tinned fish with this sort of aspirational travel experience where, you know, they're sitting on the Mediterranean coast, popping open a tin of sardines, having a bottle of wine, ripping a baguette.
In Times Square, there's even an entire store dedicated to tinned fish. When people come in,
yeah,
are they like, what is this place?
Yeah, normally people enter and asking, what is this? Is chocolates? And no,
it's fish.
Fish. Entirely
Okay.
fish.
Okay, sardine summer. So when y'all hear that, don't roll your eyes. Here's the deal with sardines. We're always talking about fish like salmon, halibut, mackerel, these fish that have high omega-3s that are good for heart health, where sardines are good as well. The key is you don't want to get sardines that are salty, okay, or that are in some type of a salty water. You want sardines that are in just fresh water, no salt. Sardines are high in vitamin D. They're high in omega-3s, and they actually are good for heart health. So if you want to have a sardine summer, go right ahead. Just please keep it a low salt summer. That's all I have to say about that one, Shador. Any more?
Let me see. No, that's the last one.
All right, good deal. Well, thank you to all of you for joining us. Please make sure you give us a like, a follow, a subscribe on your way out of the door. I very much appreciate you. As I mentioned, on YouTube, we have over 870,000 subscribers. Over 870,000 subscribers. Y'all know we're close to 1 million. And so I appreciate you for that. So make sure you please give us a follow. I take pride in giving you evidence-based information. I definitely love to discuss health disparities, health inequities, and to give you information to empower you, okay? To empower you for your safety, for your health. And I ask you to share it with the people you care about. Shador, as always, I thank you for being our co-host and always keeping up with these questions and these comments. And I just appreciate all of you. And we'll see you next Monday, same bat time, same bat place. And I want to thank you for joining me, Dr. Frita, on this YouTube Live. And thank you for making Monday your healthiest day of the week.